What are the properties of olive oil? How does it affect the body? What happens if you consume olive oil regularly? How does it slow down aging and reduce the risk of various diseases, including cancer? Can olive oil be harmful? Let's look at objective facts, verified and confirmed by qualified specialists, to understand why it should be consumed regularly and when it's best to avoid it. If you want to take control of your health, give this video a like, and let's begin. So, if you're concerned about your health, it's worth paying attention to olive oil. And there are many reasons for that. Some of them you may not even be aware of. As it turns out, even 1 tablespoon of olive oil has a powerful effect on the body. For centuries, in the sunny groves of countries like Spain, Italy, and Greece, olive oil has symbolized a healthy lifestyle. It's often seen as simply a healthier fat, but in reality, it's a true treasure trove of health benefits. From reducing the risk of cardiovascular disease to providing a strong anti-inflammatory effect, just 1 spoonful of olive oil gives your body a powerful dose of goodness. However, despite its growing popularity, it's important to remember excessive consumption can lead to excess calorie intake. That's why moderation is key. Now let's look at 10 health benefits of olive oil. Number 1, it improves heart health. Thanks to its high content of monounsaturated fats like oleic acid, olive oil is known for its ability to protect the heart. Unlike saturated fats, which raise levels of bad cholesterol, oleic acid lowers it, reducing the risk of cholesterol buildup in the arteries, one of the main causes of heart attacks and strokes. Olive oil is also rich in antioxidants, especially polyphenols, oleuropein, hydroxytyrosol, and tyrosol. These compounds play a key role in protecting the heart and blood vessels by preventing the oxidation of bad cholesterol. As a result, they reduce plaque buildup in the arteries and lower the risk of atherosclerosis. Moreover, it has been shown that olive oil improves the function of the vascular endothelium, the thin layer of cells lining the inside of blood vessels. The endothelium regulates the dilation and constriction of blood vessels and blood clotting processes. Its normal function is essential for preventing cardiovascular disease. A large meta-analysis involving 100,000 people with coronary heart disease and 38,673 stroke patients confirmed olive oil reduces the risk of cardiovascular disease. This study, aligned with the principles of the Mediterranean diet, examined the effect of increasing olive oil consumption by 25 grams. The result, a relative reduction in cardiovascular risk. Number 2, anti-inflammatory properties. Olive oil, especially extra virgin, is known for its anti-inflammatory effects thanks to its unique set of biologically active compounds. These compounds suppress the activity of enzymes involved in inflammation, COX-1 and COX-2. By blocking them, oleocanthal effectively reduces the production of pro-inflammatory substances and lowers inflammation in the body. Extra virgin olive oil, which contains phenolic compounds with antioxidant and anti-inflammatory properties, shows positive effects in treating chronic inflammatory conditions such as rheumatoid arthritis, inflammatory bowel disease, and psoriasis. A review of scientific data shows that the polyphenols in olive oil can ease symptoms of these diseases by acting on various molecular pathways both locally and systemically. Number 3, improves digestion. Olive oil's positive effect on the digestive system is linked to its monounsaturated fats and antioxidants, which support digestion. Monounsaturated fats, especially oleic acid, are easier to break down than saturated fats. This makes food easier to digest, helps the gastrointestinal tract work more smoothly, and reduces the risk of gallstone formation. Olive oil also stimulates the digestive system by improving the movement of food through the intestines. This lubricating effect is especially helpful in preventing or relieving constipation. The oil softens stools, making them easier to pass. In addition, the antioxidants in olive oil, especially polyphenols, have a beneficial effect on gut microbiota by helping maintain a healthy balance of bacteria. A healthy gut microbiome is essential for proper digestion, nutrient absorption, and a strong immune system. These polyphenols also reduce inflammation in the intestines, which is particularly helpful for people with irritable bowel syndrome. In a 4-week study, 16 patients with constipation were given olive oil at a dose of 4 milliliters per day. Results showed that its effectiveness was comparable to that of mineral oil and flaxseed oil, making it an excellent alternative for managing constipation. Number 4, improves cognitive function. The monounsaturated fats in olive oil are beneficial for the brain as they help maintain the integrity of cell membranes. This is essential for the transmission of signals between cells, a key process for memory and learning. These fats also help improve blood flow to the brain, ensuring neurons get the nutrients and oxygen they need. Polyphenols such as oleocanthal have neuroprotective properties. They reduce oxidative stress and inflammation in the brain, two key factors in the development of Alzheimer's and Parkinson's disease. By protecting neurons from damage and death, they help preserve mental sharpness. In one study, 522 people at high cardiovascular risk with an average age of 75 took part in an assessment of the effect of a Mediterranean diet enriched with extra virgin olive oil on brain health. After 6.5 years, the results showed a significant improvement in cognitive function, enhanced memory, and a lower risk of neurodegenerative diseases. Number 5, blood sugar control. The monounsaturated fats that olive oil is rich in play an important role in increasing the sensitivity of cells to insulin. Insulin is a key hormone that regulates blood glucose levels. When cells become more sensitive to its action, they absorb glucose more easily, which helps maintain stable sugar levels and prevents sharp spikes. One study involved 418 people aged 55 to 80 who did not have diabetes. Some of them followed a Mediterranean diet with the addition of 1 liter of olive oil per week. After 4 years, they had a significantly lower incidence of diabetes, and the risk of developing the disease decreased by 52%. This means that even without limiting calorie intake or changing physical activity, including olive oil in the diet can effectively prevent diabetes in people at high cardiovascular risk. Number 6. Skin and hair health. The large amount of vitamins, especially vitamin E contained in olive oil, explains its well-known benefits for skin and hair. Vitamin E is a powerful antioxidant that protects the skin from environmental exposure. Ultraviolet light, pollution, and other factors that accelerate aging and cause dryness and reduced elasticity. By neutralizing free radicals, the antioxidants in olive oil help moisturize the skin, increase its elasticity, and reduce signs of aging. The softening properties of the oil are especially beneficial for hair. It penetrates the hair shaft, moisturizes it, and reduces brittleness. The oil also nourishes the scalp, helping to relieve dryness and dandruff. According to various studies, components contained in olive oil, vitamin E, and essential fatty acids are widely used in natural cosmetics. They help slow down the aging process of the skin, prevent lipid peroxidation, and nourish and moisturize the skin. Unlike synthetic components used in cosmetics, which can cause pollution and potential health risks, products based on olive oil act gently on the skin and do not cause side effects. Number 7. Weight control. The monounsaturated fats in olive oil promote a feeling of fullness, helping to reduce hunger and the likelihood of overeating. When consumed, these fats trigger the release of satiety hormones in the brain, such as peptide Y, a hormone known for its ability to suppress appetite. Due to its ability to induce a sense of satiety, olive oil can be a valuable tool in controlling calorie intake, which is important for maintaining a healthy weight. In addition, the polyunsaturated fats in olive oil are metabolized differently than saturated fats. They are more often used as an energy source rather than stored as fat. This metabolic pathway is beneficial for weight control as it helps maintain a balance between energy consumed and expended. In a 3-year study involving 187 people following a Mediterranean diet with high olive oil consumption, a significant positive trend was recorded. Overall, antioxidant activity in plasma increased, and body weight significantly decreased. This suggests that a Mediterranean diet high in olive oil not only enhances antioxidant protection, but also promotes weight loss in individuals at high risk for cardiovascular disease. Number 8, bone health improvement. Polyphenols such as uropene and hydroxytyrosol found in olive oil are known for their antioxidant and anti-inflammatory properties. These properties are extremely important for bone health as they help reduce inflammation in the body, which over time can lead to the breakdown of bone tissue. When bone cells are exposed to oxidative stress, their normal function and balance are disrupted. As a result, bone tissue breaks down faster than it can regenerate. This imbalance is a key factor in the development of osteoporosis, a disease in which bones become brittle and prone to fractures. Moreover, monounsaturated fats, especially oleic acid, also contribute to bone strength. These fats improve the absorption of fat-soluble vitamins such as vitamin D and vitamin K, which are necessary for the formation and mineralization of bone tissue. Adequate levels of these vitamins are vital for maintaining bone density and reducing fracture risk. When studying the benefits of olive extract for patients with osteoarthritis, impressive results were obtained. In a randomized trial involving 30 osteoarthritis patients aged 55 to 75, daily intake of 400 milligrams of aqueous olive extract for 8 weeks led to significant improvements. In another study, hydroxytyrosol was used to treat knee osteoarthritis. Participants who took 50 milligrams of olive extract daily for 4 weeks reported noticeable pain relief and improved knee function, indicating the therapeutic potential of olive oil in supporting bone health. Number 9. Strengthening the immune system. Olive oil, especially extra virgin, is beneficial for the immune system primarily due to its high content of antioxidants, including vitamin E. Vitamin E is known to enhance the function of T cells, a type of white blood cell critically important for immunity. White blood cells play a key role in the body's response to pathogens. By strengthening the T cell immune response, olive oil helps maintain immune memory, which protects against repeated infections. Additionally, oleocanthal, a polyphenolic compound in olive oil, has anti-inflammatory properties. It acts similarly to ibuprofen, a well-known anti-inflammatory drug. By inhibiting the activity of specific enzymes in the inflammatory process, oleocanthal reduces inflammation in the body. In a study involving 41 overweight or obese elderly individuals, replacing regular cooking oils with extra virgin olive oil yielded positive results. Participants who consumed olive oil experienced reduced systolic blood pressure, increased levels of good cholesterol, HDL, and enhanced T-cell proliferation, which is directly linked to improved immune function. This points to the cardiometabolic and immune benefits of including olive oil in the diet of older adults. Number 10. Reducing cancer risk. Polyphenols found in olive oil have anti-cancer properties and may reduce the likelihood of developing certain types of cancer, including breast and colon cancer. These powerful antioxidants fight processes that contribute to the formation of cancer cells. The mechanism of polyphenol action lies in their ability to counteract oxidative stress and inflammation. They can also influence the expression of genes responsible for tumor growth and reduce their activity. Breast cancer. Several studies show that regular consumption of olive oil may be associated with a lower risk of developing breast cancer in women. This may be due to the high content of monounsaturated fats in the oil. Colon cancer. The polyphenols in olive oil also provide protective effects against colon cancer. They help prevent the formation of polyps, precursors to cancer, and reduce inflammation in the intestines, decreasing the likelihood of malignant changes. Additional factors. It is important to understand that reducing cancer risk is not only associated with olive oil consumption, but also with overall lifestyle and nutrition. Moderate consumption of olive oil in combination with regular intake of fruits, vegetables, and other antioxidants plays a key role in cancer prevention. Further research. Despite encouraging results, additional scientific studies are needed to better understand the mechanisms of polyphenols in olive oil and their relationship to various types of cancer. This will help develop optimal strategies for cancer prevention and treatment. Now attention, what potential dangers can olive oil consumption carry? Overall, olive oil is a healthy choice when consumed in moderation as part of a balanced diet. However, it is important to consider possible issues, especially if you have certain diseases or dietary restrictions. High calorie content. 1 tablespoon of olive oil contains about 120 kilocalories. Excessive consumption may contribute to weight gain. Allergic reactions. Although rare, some people may be allergic to olive oil, causing rashes, eczema, or difficulty breathing. Gastrointestinal disorders. In large quantities, olive oil may cause digestive issues such as diarrhea. It acts as a natural laxative, which in excess can disrupt normal body function. Blood thinning. Olive oil has blood-thinning properties. This may be beneficial for preventing clots, but can be dangerous for people with bleeding disorders or those taking blood-thinning medications. Oxidation and free radicals. When heated to high temperatures, olive oil can oxidize, forming harmful free radicals. To avoid this, it is important to use the oil within its smoke point. Impact on nutrient absorption. Excess fat consumption, including olive oil, may interfere with the absorption of other nutrients from food. Purity issues. There are concerns about counterfeit olive oil on the market. Some products labeled as extra virgin may be diluted with cheaper oils, which can negatively affect health. Important question: how much olive oil can you consume per day? The safe amount depends on many factors, including your overall diet, health condition, and energy needs. In general, olive oil is a healthy source of fats, antioxidants, and vitamins. Health organizations recommend that total fat intake, including oils, should make up 20 to 35% of total daily calories. As for olive oil, it can be included in the diet, but in moderation. The commonly recommended dose is 1 to 2 tablespoons per day, approximately 15 to 30 milliliters. This amount can be distributed between cooking, salad dressings, and other uses. It's important to remember that despite its benefits, olive oil remains a high-calorie product. Therefore, when consuming it, you should consider your total diet and monitor your daily caloric intake. If you have medical conditions or dietary restrictions, it is recommended to consult with a doctor or dietitian for personalized guidance. And now, a bonus, a few useful tips. How to choose olive oil properly? Olive oil is not just an ingredient, it's the key to amazing taste and health benefits. Choosing the right oil is not easy, but here are a few hints that will help. Secret number 1, purpose of use. First of all, determine what you need the olive oil for. If you plan to cook hot dishes, it's better to choose oil that contains refined oil. But for salads and other cold dishes, extra virgin oil is preferable. Secret number 2, color and shade. Olive oil can be bright yellow, green, or dark golden depending on the variety and the origin of the olives. The shade also depends on their ripeness. High-quality oil should always have a fresh aroma. Secret number 3, taste and aroma. The flavor of the oil depends on the olive variety and may vary, but low-quality oil is often characterized by a lack of flavor or rancidity. Good oil has a slight bitterness and a pleasant aroma reminiscent of tart herbs and fruits. Secret number 4, information on the label. Carefully read the label. It should indicate the product category, acidity index, no higher than 3.3%, storage recommendations, and more. The producer's address, importer details, and country of origin are also important. Secret number 5, origin and quality. Many producers offer olive oil, but Italian oils most often provide the most complete label information, including the place of production. Different regions of Italy offer a variety of flavors, from greenish and fruity Tuscan oil to golden yellow or green oils from Sicily, Apulia, and Calabria. Secret number 6, regional characteristics. Tuscany, greenish tint, fruity taste. Ideal for seasoning rice, spaghetti, grilled dishes, and soups. Umbria, delicate taste, suitable for light meals. Sicily, Apulia, and Calabria, golden yellow or greenish tint, bright yet pleasant flavor, great with meat and vegetables. Liguria, yellow or light green oil, perfect for lovers of subtle flavor. Ideal for basil-based sauces. Gardesano, similar to Ligurian oil, but with a more pronounced fruity taste, used for fish dishes. Choosing olive oil means getting to know a culture and its flavor. Remember the importance of quality and trust your taste to discover the world of this amazing product. Now let's look at the trade secrets of storing olive oil. Olive oil is not just, it's about taste, it's optimal condition. Let's talk about how to store this valuable oil properly to preserve its quality and flavor. Secret number 1, proper packaging. Olive oil is best stored in dark glass containers. Glass protects it from light exposure, which can negatively affect the oil's quality. Secret number 2, optimal temperature. It is recommended to store oil at room temperature, away from heat sources and direct sunlight. However, if you've chosen a cold-pressed product, remember that it may freeze at temperatures from 8 to 10 degrees Celsius, 46.4 to 50 degrees Fahrenheit. Don't be alarmed if the oil becomes thick and milky white. This is completely normal. Secret number 3, refrigeration. Some people prefer to store olive oil in the fridge, especially during hot weather. In this case, make sure the container is tightly sealed to avoid external odors. When stored in the refrigerator, oil may thicken, but it will become liquid again when returned to room temperature. Secret number 4, quality control. High-quality cold-pressed olive oil may thicken and become milky white within just a few days of storage at low temperatures. When returned to room temperature, it becomes liquid again without losing its properties. However, if the product doesn't fully thaw or if white flakes appear after refrigeration, this may indicate that the oil is diluted or made from low-quality raw materials. Storing olive oil is the art of preserving its unique taste and benefits. By following these simple tips, you'll provide the best conditions for the oil to retain its outstanding qualities. Thus, consuming just 1 spoonful of olive oil a day can significantly improve our health. Just 1 spoonful of olive oil per day can greatly improve our health, providing a range of 10 benefits, from supporting heart health to improving cognitive function. This simple yet powerful dietary addition embodies the essence of both traditional and modern nutritional science. However, it's important to remember that olive oil is a wonderful superfood, but not a cure-all. Everyone has individual health and nutritional needs, so the use of olive oil or any major dietary change should be accompanied by professional medical advice. If you have any questions or something to say, leave a comment. You'll find more information on this topic via the links in the description under this video and on our channel.